We've talked a lot about how to create messages that will resonate with our audiences. We've learned how to effectively persuade, and we've talked about how to truly engage with others. Social media is a place that we can bring all of this learning into practice. Over the course of the next week, we're going to explore the use of social media in healthcare. One thing I want you to remember is that social media platforms are not a kind of communication. They're simply a mode or media for communicating. Among the primary benefits of the use of social media platforms is that they really enable us to tell our story directly to our audiences. Remember the importance of listening and active listening? Social media provides us a way with doing that. We can define our audiences and use a variety of tools to actively listen to what people are saying about us, our organizations, perhaps our competitors, and so much more. We can learn a lot by listening to what's being said around us, and we can also respond and interact, creating an engaging two-way flow of communication. Social media platforms also provide us with a way to build relationships with others through engagement. From a communication perspective, these platforms enable broader media integration. You'll see in this chart the two top areas, paid media and earned media, are both costly to an organization in terms of advertising, as well as time spent attracting media or blogger attention. Owned media is the content that organizations are already producing. You'll see these as parts of corporate communication efforts. And social media platforms or shared media really enables us to maximize the use of all of this work, providing us with additional platforms where we can control our messages and target our publics. Social media opens doors of opportunity for us to truly connect with our stakeholders. So to summarize some of the benefits of social media, they help us better understand how our patients or community feel about our organizations. They give us a chance to tell our story without a filter, and they provide us with an opportunity to listen, respond, and interact. So when we're talking about using social media, we need not to think of it as technology and instead think of it as a community. This will help us create warmer, more engaging and authentic opportunities to meet one-on-one with people. We also need to stop thinking about demographics and start thinking more about tribes and humans. Marketing principles have taught us to segment our markets, but social media provides us with a platform that enables our audience members to self-select. They'll choose to engage with us when we're providing engaging information for them. People aren't programmed to think certain ways or agree on certain things. Instead, we are all unique. Your social media engagement should be unique too. And when you work in healthcare, the organization can sometimes become your world. Remember that life doesn't revolve around your hospital or clinic. People will engage with you based on a variety of interests and will bring differing perspectives to your conversations. You need to be human in your online activity. Don't try to represent an organization voice or persona. People connect with people. And remember, there's no rule book for how to participate in social media, of course with the exception of the application's user guides and regulations. It's a world based on humans and real-life connections. Social media levels the playing field for people. Your followers may be the CEO of a large company, a teenager in their parents' basement, or someone participating online in the local library. All of them tend to have a similar amount of weight in their voices in social media. Remember, social media can get messy, and it's where true engagement happens a lot of the time. So who's out there? In 2014, PhD Canada research was commissioned by the Interactive Advertising Bureau of Canada to provide some statistics about Canadian life online. And here's what they discovered. Adults spend close to 28 hours a week online. 53% of that is spent on mobile devices, and 9 hours of mobile time is spent on non-video activities. Digital is 35% of our weekly media time. TV is 37%. But for millennials, 55% is digital, and those numbers are growing. Think about the implications that has for your workplace as well as healthcare. Before we move into the challenges of social media, I'd like to speak for a moment about a growing community of healthcare providers in Canada who are on social media and who meet weekly in the form of a chat on Twitter to talk about the real-life uses of social media in their day-to-day work. You can find out more about this group by Googling #HCSMCA or visiting the WordPress blog of Colleen Young, who is the moderator for this wonderful group. So let's move on to some of the concerns that healthcare organizations may have about social media. One of the most common is the perceived threat to the organization's reputation. Now, reputation often depends on the attitudes, behavior, and work ethic of the individual employees or members or the faces of the organization. Customers, consumers, and patients may make judgments about the quality of the organization based on both conventional, face-to-face, telephone, and digital interactions with employees. Conversations and communication that may be innocuous in traditionally private settings can be judged differently when made available to the online public. Further, unlike conventional conversations, discourse in the social media world is accessible to a much wider and often unknown audience and can linger in perpetuity. A flippant or facetious comment, statement, or video post could easily be captured and disseminated through various forms of media. Privacy is another concern that's widely cited by organizations reluctant to take part in social media. Communications regarding personally identifiable patient information must be secure and transmitted only to permissible parties. Water cooler talk among colleagues regarding patients, while inappropriate and in violation of the rule, is not likely to draw scrutiny, but that type of conversation on a social media application exposes an organization to greater risks. Another area of concern is the time and attention employees may be allocating to social media discourse while on the job. Use of social media applications can consume a significant amount of time, even if that time is in small increments. Mobile access to social media is increasing at a rapid pace, and phones are becoming more sophisticated, and users desire constant access to social media resources. There are currently 150 million Facebook users who access the application via mobile devices, and those users are twice as active on Facebook as other users. In healthcare settings, distractions that could result in medical errors are more problematic than lost productivity. And finally, how do you train and educate your staff to use social media wisely? Corporate policy should not be the organization's sole means of addressing social media use. Many of the legal and ethical issues associated with social media use in the healthcare professions are still very obscure, and all healthcare professionals should be cognizant of these issues. Policy cannot address the myriad of social media nuances and controversies that may arise. Therefore, employee education may be necessary to reduce potential problems. Later this week, we're going to learn how the North American healthcare social media leader, Mayo Clinic, addresses many of these concerns.